Have you ever wondered why some European men, though entering their sixth or even seventh decade, continue to radiate a magnetism that not only persists, but often grows more profound with time? My name is Dr. Lauren Pierce, clinical psychologist and expert in integrative aging, and today I invite you on an extraordinary journey, a masterclass in the science, psychology, and art of mature male attractiveness. Let's dispel a stubborn myth that male allure inevitably fades into obscurity with the passage of years. On the contrary, across my research and clinical work in Berlin, Milan, and Paris, I've witnessed the very opposite. Maturity can catalyze a transformation, revealing new levels of charisma, authenticity, and subtle power. This allure draws on the entirety of a man's physiological, neurological, and emotional evolution. The distinguished Danish architect Erik Sorensen once told me, "Lauren, I now realize that the most captivating men I meet at my age bear signs of history. Sculpted wrists lined by experience, postures built by years of decision and care, eyes rimmed with the wisdom of laughter. These are not accidental features. They're backed by robust biomedical and psychosocial processes, what I call the hallmarks of experienced masculinity." Let us begin with the concept of age-related facial and bodily attractiveness, defined in European clinical literature not as simple beauty, but as aesthetic congruence, the harmony of expressive wrinkles, skin health, and composure. Empirical studies using machine learning facial progression demonstrate that attractive, mature men are most often described by observers as elegant or distinguished, linked to biopsychosocial factors such as skin turgor, periorbital rhytides, and posture integrity. To unlock this degree of attractiveness in later life, we need to address the key areas through targeted, evidence-based protocols, ranging from anti-inflammatory nutritional interventions and neuroplasticity training to advanced dermatology and endocrinology. Let me ground this with scientific detail. Wrists and hands. The biofeedback interface. Clinical observations confirm that neurocognitive processing of physical security and trust is affected by a man's hand hygiene, vascular presentation, and coordinated movement. Daily regimens should include medical-grade hand emollients containing urea or ceramides, active joint mobility routines, and annual neurological screening for early signs of fine motor deficit or peripheral neuropathy, a risk in men post-60, especially with a history of metabolic syndrome. In Erik's case, bespoke daily stretching, vitamin D supplementation, and mesotherapy for skin repair were integrated. The result? Hands that project both vigor and precision, attributes subconsciously noted by women and colleagues in social professional contexts. Posture and back, the pillar of presence. Let me bring you to the modern rehabilitation gym in Vienna, where Professor Matthias Grimm demonstrates corrective postural routines employing proprioceptive therapy, resistance band workouts, and biofeedback-enhanced core stabilization. Medical research affirms that kyphotic, hunched postures in elderly European men correlate with reduced pulmonary function, impaired cardiac output, and poorer social perception. Summary of best-in-class medical interventions. Weekly assessment by musculoskeletal physiotherapists. Alexander technique and Feldenkrais method exercises. Periodic DEXA scans for osteoporosis monitoring. Custom orthotic evaluation for gait optimization. Neck and jawline. The axis of authority. Aging-related ptosis, sagging in the cervicomandibular region, can be proactively managed through multimodal interventions. Low-level laser therapy to stimulate collagen synthesis. High-frequency ultrasound skin tightening, HIFU. Nutritional neuroendocrinology, high-protein, omega-3 rich Mediterranean diet, magnesium and vitamin C supplementation for tissue repair. Periodontal screening, jaw muscle myotherapy, ambulatory vitality. The locomotor signature. Physical vitality is indexed in gait analyses. Lucia Delgado, a Spanish physiotherapist in her 70s, designed for herself and her husband Miguel a progressive ambulation protocol. Dynamic balance drills, interval-based Nordic walking, and targeted physiotherapeutic interventions for proprioceptive feedback. Medical data support that those men integrating 150-200 minutes of moderate to vigorous aerobic activity weekly, monitored through wearable trackers and supervised by sports medicine specialists, show up to 35% lower age-related frailty index and improved cardiovascular and sexual function. Facial lines, signs of positive affectivity. We must challenge the cosmetic industry's negative framing of periorbital retides, crow's feet, and nasolabial folds. Women across Paris, Munich, Rome, and Zurich consistently describe such lines as testaments to a loving, resilient character. Dermatologists now recommend photoprotective regimens, broad-spectrum SPF 50+, as well as pro-collagen peptide serums or non-cross-linked hyaluronic acid injectables for enhancement. Crucially, anti-aging protocols are now being integrated with mental health interventions. Gratitude journaling, mindful laughter, positive affect therapy, all contributing to facial expressions perceived as warm and magnetic. Sexual health and endocrine optimization. A biopsychosocial model of aging cannot ignore androgen deficiency. European consensus now supports testosterone replacement therapy, TRT, for hypogonadal men after thorough cardiovascular and prostate screening. Patients must be educated regarding risks, erythrocytosis, potential prostate hypertrophy, and monitored through periodic PSA hematocrit checks and digital rectal exams. For non-candidates, DHEA supplementation and lifestyle optimization, body composition, sleep hygiene, stress reduction are recommended. Cognitive and emotional longevity. Longevity is not just physical. Men participating in cognitive health programs, chess, language learning, music, show delayed neurodegeneration. Social engagement through clubs, volunteering, or group therapy prevents isolation and supports neuroplasticity. Mindfulness-based interventions attenuate age-related cortical thinning and reduce cardiovascular events. Holistic anti-aging protocol. My Lauren Pierce European Gentleman Protocol synthesizes findings from geriatric medicine, endocrinology, neurological rehabilitation, and clinical aesthetics. Quarterly biomarker panel, lipid, glucose, inflammatory markers, sex hormones. Annual physical and mental health screenings, PSA, DEXA, echocardiogram, cognitive performance, depression, anxiety scales. Individualized nutrition plan, Mediterranean emphasis, caloric moderation, prebiotic-probiotic optimization. Dermatology consults, annual mole mapping, preventive actinic care, photoaging assessments, specialized male skincare regimens, retinoids, niacinamide, antioxidants, movement prescription, personalized exercise plan, blending aerobic, resistance, flexibility, and coordination activities. Sleep medicine evaluation and cognitive behavioral therapy for insomnia when appropriate sexual health optimization. Counseling, TRT if medically indicated, pelvic physiotherapy. Advanced stress resilience training, mindfulness-based stress reduction, psychotherapy as required, case studies and expert testimonies across the continent, my colleagues and patients, Eric from Denmark, Matthias in Austria, Lucia and Miguel in Spain, and Helen and Gustav from Vienna, have rewritten their second adulthood. The unique value of a European lifestyle, socialized healthcare, strong community networks, and cultural esteem for maturity makes outcomes here particularly positive, provided these evidence-based protocols are embraced, personalized, and sustained. There is so much more to share. The role of circadian rhythm in testosterone output, epigenetic modulation of skin aging, the impacts of sleep architecture on memory and libido, and the cutting-edge technology for monitoring real-time health trajectory. Over the coming hours, we will delve deeper into every domain. Each chapter will include advanced terminology and medical subtopics, extended expert interviews from endocrinologists, geriatricians, nutritionists, and mental health professionals across Europe. Practical guides, from laboratory interpretation to hands-on mobility drills, meal plans, cognitive workouts, and dermatological routines. Let this be your comprehensive resource, a living textbook for the modern, mature European gentleman, underpinned by science, enriched by real human stories, and delivered with the conviction of someone devoted to your flourishing. So, let us begin with courage, curiosity, and the resolve Dr. Lauren Pierce believes every man over 50 still possesses, waiting to be refined and unleashed for a second adulthood as potent, passionate, and authentic as the first.